just start?
Yeah.
Okay. Hello, nice to meet you to the webinar about endometriosis and how to use the maple rope. My name is Sonja Soeder. I have a practice since 2001 and I'm being a part of the German Pelvic Floor Center since 2005. I'm teaching at the Physiotherapy studies at the Alice Salomon University of Applied Science in Berlin and being a part of the Charité University Medicine, the Endometriosis Center since 2023. And I'm aboard on the special interest group about electrotherapy and the German Physiotherapy Association. And I'm using maple since 2014. I'm very happy about it. And I would like to share my experiences with my patients I could treat and help a lot. So there came no questions before because of a technical problem. And I go just to the important message, almost treat after the diagnosis. That's the most important thing about all patients, but especially with the endometriosis, because it's a chameleon, and I would like to share some information about endometriosis, why it's so important. About 6 to 15% of all women of childbearing age are affected. Approximately 40,000 new cases per year only in Germany. And the really hard thing is the diagnosis takes mostly 6 to 10 years, and it's often discovered by an unfulfilled desire to have children. The treatment should be almost multimodal, so the diagnosis can be confirmed by ultrasound, MRI, or laparoscopy. The initial steps are a hormone therapy, pain medication, physiotherapy, psychotherapy, nutritional therapy, and self-care. So it's almost important to teach our patients self-care and how to help themselves and how to find the right medication. And there's an interacting and a multimodal team very helpful because we can help them almost when we have a good contact to the gynecologist, to the dietitian, to the psychologist, and with the physiotherapy as well. So the common symptoms we can really work on very, very hard and successful is the cyclic and acyclic chronic lower abdominal pain and the dyspareunia. Most of these patients going to the doctor or going to the physiotherapy for some other reasons and have chronic lower abdominal pain or dyspareunia, and nobody is thinking about the endometriosis. So the dysmenorrhea is also one step to think about endometriosis. So a particular hypertonic pelvic floor muscle and pelvic pain, almost important signs and almost symptoms we can treat. And muscle trigger points are a very important part on it because sometimes the pelvic floor seems hypertonic or seems pale, very, very weak or very powerful, but it's a mix, and it's very, very rarely the whole pelvic floor hypertonic. And I have some patients I like to share with you to explain it, how I see this in my practice and with the maple device. So physiotherapy is offering diagnostic and treatment, and very helpful is a maple device. So caused by the probe and all these exactly situation of the muscles, and if they're in a normal tone or more hypo or hyper tone, or in the active situation hyperactive, I would say it's not almost asymmetrically contraction, and that's what we would like to see. So we can't say we would like to have an EMG from a certain number. The best thing what we have is, or what we can have, or what is our target, is to have a symmetrically situation. So just, yeah, really nice one color with a bit of shadows, but not like you can see in this history of the patient. What can we do also when we have when you have the diagnostic that the pelvic floor is very very tense and painful, and we made in our department a study with Maple to see with the pelvic floor hypertension what possible factors for the pelvic floor tenderness in the endometriosis patients we can find. And what we found is there's a dyspareunia and pelvic pain, and it's very difficult for the patient to release, to be aware of the pelvic floor, to find a contraction. So what we did, we gave them only the current to reduce the pain. So the pain program, what you can find in the menu of Maple, and we found really good results. So most of them became pain-free, and we could start a good treatment. We could start to train the pelvic floor, and that was very important. What I did 2021 was a trigger point therapy combined with the pelvic floor training and a biofeedback assessment. And this shows significant benefit with dyspareunia and dyschizia. So after I treated the trigger points, and that's also very often with pelvic floor endometriosis patients, that they have trigger points and they have tense muscles. And if we are able to investigate vaginally, then it's good to treat the trigger points. And if they're released, we can start the training. So that's a very important part, what we find and what the research shows as well. Now to the practical part. And first, about the contraindications, almost very, very important to think about. So one is the pregnancy, but pregnancy is only related to the electrical stimulation. Biofeedback, it's possible, and carcinoma, it's a relative, because it's a question how close it is. Neurostimulator, like another device, like pacemaker, and impaired sensitivity, psychodynamic pain, and skin conditions. It's almost a relative, but sometimes some patients have other problems as well, and the skin around the pelvic floor is not very good and painful. So then we do different things, and of course a written fear of the patient. So what do we need? What it's not a good contraction? I took it from my colleague. Jill has another position on the probe. You have to adjust the phase duration. You have to adjust the frequency, and you have to switch the electrodes that will have a good result. The application is almost improving the coordination of the pelvic floor, improve contraction, the inhibition of the detrusor, pain relief, influencing the muscle tone, and awareness. So that's very important when we think about the parameters. It's almost important that it's not painful. It has almost to be, the patient has to feel the current, but it should never, ever be painful or uncomfortable, and the patient shouldn't become tense or anxious about the current. And also, it's important, some patients are telling us that when they contract a few times, it's getting pain as well. So for that reason, it's important that we listen and that we stay with the patient, especially during the first treatment, and to talk with them. These are the parameters from Maple, who is working with it as knows it already, and all the frequencies again is just for information. And here's my first patient I share with you. She's 40 years old, has 2 vaginal births, has had 3 times surgery for endometriosis, caused by endometriosis. And I show you the June 2022 and the August 2023. And she's still in the treatment, but what I'd like to show you is the important thing. So if you look in June, the resting tone, you can see here a bit of a difference of the gray, and you can see there are some moments, but she can relax very well. When we do Maple, then she has no bleeding, because I think it's not a very nice situation, and we shouldn't do current during menstruation. So when it's not the real menstruation, just the last day, then it's fine. But this patient, she's coming once a month, and when she has really pain or problems. So when she said, okay, now today it's a good day to do to train the pelvic floor, I would like to see where I am. So for that reason, here's 1 year in between. And I think it's very nice to see the fast contractions. It's left, right side, it's quite symmetrically, but if you see the contractions, then it's not that nice compared to 1 year later. It's a better contraction. It's inside in the deep of the pubococcygis and puborectalis. You can see it's more intense. But if you look to the resting tone, it's very nice. And after the treatment with the current, you see it has a bit more tone, but it's quite nice. It's symmetrically, and that's what we like to see. And here we see with the fast contraction, it's more coordinated. She has more control. It's not like not the high going up on like in June 2022. It's a better contraction, and it's more harmony in the contraction. Now the same patient again in June and August with the with all single contractions, and there you can see on the top it's a fast contractions, and the below it's a 15 seconds and the resting tone. And again, after 1 year, and after she has had current for stimulation, and what I do mostly, I support with patients like her with a really nice resting tone. I almost give a stimulation to the muscles who are not so good in the contraction. So here I was almost stimulating the last, or the 3 external grids or rings. Yeah, from here, all these 3 I stimulated with the current, who was give more contractibility, so 35 hertz. And you can see in the beginning, 2022, it's not a very good coordination of the contraction, but 1 year later, again, once back, again, you can see the fast twitch. It's more symmetrically. It's still something to do, but everything looks more coordinated. And below the 15 and 15 seconds resting, it's again, it's a coordinated, a voluntary contraction, and she is able to relax very fine. She's able to hold it and to relax. So, and you see all contractions are more symmetrically compared to the other one where it's more like very powerful, but not for a longer time, not for a good concentration of the muscle. They can't hold that good. And at the beginning, she wasn't able to do more than 5. And now, after 1 year, it was 8, but now she is really able to continue. Now we starting to work in a standing position, and when she has pain and feels really pain, then I do sometimes the pain current for 20 minutes, and after that we make a rest for a while, and then she starts just training with the probe of endurance and fast contractions. Patient number 2, she's born in 1996. She's a nullipara. This is all from the June 24, so you can see how does it work on one day. Excuse me. 1 day training. This woman, when she started the therapy with me, she wasn't able to have any intercourse. She couldn't use a dilatator, or she couldn't use the probe in the beginning. So we worked a lot from externally. And then it was very, very fine. I gave her a probe home so she could try to use it with Jill, because she has had some moments of very painful intercourse trials, and for that reason she was very tense just thinking about a probe. Also, that what I said in the beginning, working multimodal, she went to a psychologist to talk about it and to cope with the situation of endometriosis. And all these things together are very helpful. Also hormones, and some patients have still bleeding after they got a Mirena. So she was one of these, needed to take more hormones, and it was a long process. And altogether, it was very helpful to have a psychologist to cope with the symptoms and with the diagnosis. In the meanwhile, she's able to have intercourse. It's nearly pain-free. It's only a visual analog scale from 2. And if you think about that, she started with 10, then it's really a very good result. And sometimes it's pain-free as well. She's doing regularly her exercise and using the current. We do in the meanwhile only once a month the treatment. So now we have the first on the left side the 10 contractions, and looking quite overloading. But if we look at it more differentiated with the 15 seconds, it looks different, and it's not a good coordination anymore. And it looks quite nice, but it's for me too much of overloading. So it's a sign for trigger points to contract very hardly, and then you have a very, very bad coordination. What you can see here, it's going very fast down. So it's going fast up, and again, suddenly very, very low down. What's very good after the second time, so you can see it after the time, after this, I gave her some current, and I gave her current for relaxation. And what was very helpful, and she could relax much better. And caused by the relaxation, the contraction became also better. If we look on the right side, we can see we have to look here. That was 4:05. So this is belonging to this measurement. And if we look at all contractions, all 10 contractions, you can see she's not able to relax anymore. She's contracting, and the relaxation is getting worse. That was my decision to give her a relaxation current and also a pain pain reducing current for 15 minutes. And here we see again the endurance before the current, and you see it's not very nice, and after the current it looks quite nice. So the coordination and the relaxation became much better. So this is a patient. She's very tense, and she's sometimes getting nervous about how is it today, and can't believe sometimes how it improved. But if we think about her history, we can understand this quite well. And what I learned with all these patients is to listen. How is it today? That's so important. How is it today? How's your feeling today? How do you feel? Do you feel more tense? And then I look at the screen, then I look on the EMG result. And when I see incongruence in the contraction and a very bad relaxation, then I try almost to bring it in a good relaxation. When the muscle can relax, then it's much easier to contract correctly. And also, I tell them almost to become in a different awareness, and they don't have to go so high while they're training, because I would like to have a good coordination. I would like to have a good coordination and see quite good results. What we can see right now, that's her again. So on the left side, you see the June again, and now you've seen how it's now in October. We made it on Tuesday to bring you the new results, and you can see on the lower side, the left and the right contraction, and it's a better contraction, it's a better relaxation, it's more coordinated than it has been before. I did only 3 because it was a hard session of relaxation, of coordination, and the current as well. So this one is done after the current, because here it was a good relaxation, but it hasn't been that good in the in holding and in the endurance of the pelvic floor. And here, this is also after the current, and this is in the beginning. And you see after she got the current and last time. So here I made everything for relaxation. I used the current. It was for relaxation. It was to take the pain away. And here on last Tuesday, she was much better. She was in a good mental situation, and we could say, okay, here it is not, there are all the externals are not working so well. So we gave them a bit power and gave them 35 hertz to support the other muscles, so that they didn't need to do everything alone. And the result was a better coordination, a better relaxation, and here also a coordinated contraction. Patient 3, she is 44 years old. She has 2 vaginal births given, and she is a patient after cervix carcinoma and surgery caused by the carcinoma and endometriosis surgery in Douglas and urethral. Also, she has pain, muscle trigger points, no intercourse is possible. So I show you also, and I decided to give you the colorful pictures, because I feel it's something what's very often with patients who has pain, who has trigger points, who has had a long history of medical treatments, and at least everything was sorting out very well, but still her quality of life is not very good, caused by her pelvic pain. So she can't sit for a long time, she can't have intercourse, and she can't very good contract. So caused of her bad relaxation. So if we look at the beginning of the treatment, it was yeah, you can see it. So a part is not very, has not a very good tone. A part looks like a hypertonic situation. It's a resting situation. Oh, a moment. Yeah, it's a resting situation, and it's on a very high level, 6 to 8. So it's the mean, it's 6.7. That's quite high for vaginally. If we look now, I gave a relaxation just in the and for the 4 rings from here to here, and it became a bit more tense. It's a 6.9. So it wasn't it didn't work so well. So we made some relaxation exercises, some breathing exercises, and I gave her again, during these exercises, I gave her again a bit current, and this time I used only the external rings and gave her support. So I gave her 35 hertz to give support for the other muscles, and at the same time we made breathing exercising like the pranayama from the yoga, and everything was a bit more relaxed, so we could go down to 5.5. She felt much better, and she was able to start a correct contraction. Here now, that's the resting time after the second current. Here we have the fast contractions before the second current, before the supporting current, and then you can see it's going up and it's not going in a good relaxing modus. So sometimes we have it when patients contract a few times, then they have a better relaxation, but it didn't work. We did only 3 because she said, okay, I don't feel I have pain and I can't do it. So I'm in a high tense. So after that, I did the current who is supporting a bit the external parts of the muscles, and it became a bit better. She could better relax, and she hasn't had any pain anymore. So it was 10 contractions of 3 seconds. And when you see, the relaxation became much better compared to the beginning. So I think it's almost important. Sometimes you can do 2 sessions because it's so easy to sort out which part of the muscle needs more support, which part needs more relaxation or pain reducement. And for that reason, I think it's a very wonderful to talk with the patient about the results of our measuring. Sometimes we don't know it before, but we have to see and we have to discuss and we have to listen to the patient. So, and I can see here the relaxation became better, the contraction was coordinated. It's still not wonderful, but we are working on it. And here we have the endurance. It was also after the second current, and you can see the relaxation, that was an important part for me, became better, because when this woman learns to relax better, then she can have a better coordination and a better contraction as well. So this has been my patients, because this is only yeah, it's without any interaction with you. I would suggest, if you have any questions or if you have any patients you would like to talk about, just send me an email and send it to sonja.soeder@charité.de. So sonja.soeder@charité.de, and just write it to me. I would like to give a little overview about my thoughts from the patients with endometriosis. So if they're able and happy to use the probe, I think Maple is really wonderful. I also made very good experiences if we use it rectally. Most of the patients prefer the vaginal probe because they feel it's more close to the main problem. So we try to find a few some exercises to relax, and I think it's a good way to give them the probe one time to try at home, to get used to it, to get used to the probe, and then they bring it with them for the treatment, and give them time, give a good atmosphere, and if they can see how it's looking like, the contraction, like the last patient with the carcinoma and the endometriosis, she said, yeah, that's exactly what I feel. And I think that's an important part to tell patients, that's what you taught me, and now you can see it. And I think that's a fantastic idea of Maple, to see which part of the pelvic floor has at this moment a problem. And that's the most important thing of endometriosis. It's a chameleon. In 2 weeks, it's coming out with a different situation because of the pain, because of some other reasons. Then we have to find another way, or to find more relaxation, or if they're in a good mood, and that's what we all know, that all women belonging to a cycle belonging to the menstruation cycle and their pelvic floor activity and awareness. So we have almost good times, and all my patients, or a few of them, coming still every month or every second month, and how to see how they improved with their home training, or if they have really bad times of pain, then we have also a very good result and influence to back pain when the pelvic floor is relaxed and can work much better, and they can do their home exercises or their self-care. If they have really, really bad pain, sometimes I give them also some heat in the um, lower back, on the sacrum, and that's also a very good thing for relaxation. And then they feel very good, can relax, and we can measure it. It's very nice to measure how to work the exercises. For that reason, I gave you the example of the patient where I made some breathing exercises and some current, and she could see, oh, wow, it does work. And I think that's the most important thing, that the treatment is working and that we can send it to them, and that we can see how it has been 1 year ago, and it's a valid exam. It's not like what we feel, and that's something I do as well. And I do the trigger points, and I look that all muscles are trained. So the pelvic floor is one part of a multimodal treatment of endometriosis, and it's one part of the opportunities of physiotherapy. So of course we have to think about other things as well, but the pelvic floor is, it's the core, and for that reason we have to work on it. So I hope you will start next week with some endometriosis patient, and if you have some more questions, just let me know and write an email to me. And I thank you very much for listening. So take care.